Welcome to the Therapist HQ, your weekly pep talk for private practice pros. Let's dive in.
Welcome back to the Therapist HQ, your weekly private practice pep talk. My name is Alicia Murray, and today I am so happy to be joined by Mandy Jones-Fisher, who is an LCSW registered play therapist supervisor and an attorney based in Chicago. She's the founder of Nurtured Roots Counseling and Consulting, where she specializes in working with adoptive and foster families, attachment, and children navigating big feelings. She also brings a legal lens to her clinical work, having advocated for children in both the Illinois and Michigan child welfare systems. But today, we are here to talk about something that hits very close to home for a lot of therapists in private practice, which is getting paid fairly for the work that we do. Mandy was involved in the advocacy around Illinois' House Bill 1085, the mental health parity bill that was signed into law in December 2025 and takes effect today, June 1st. Oh, no.
January
Not
1st,
today.
2027.
January 1st,
6 more months. 6 more
We got a
months.
little pushback. Okay. January 2027.
Coming. It's coming.
And it's coming. We're so close. And the legislation is going to require insurance plans in Illinois to establish reimbursement rate floors for mental health and substance use disorder services, which means insurers can no longer lowball behavioral health providers the way that they have been. And this passed the House, correct me if I'm wrong, 7233, and the Senate 4810. So this was not just a quiet little bill. So, Mandy, welcome.
Yeah. Thank you for having me. I'm so excited to be here.
Yes. Is there anything else you want to tell us about yourself that maybe I did not get there?
I train, I supervise, I'm growing my
Amazing.
training catalogs as well. I do a lot of work with Self of the Therapist. So, and I'm training around the country. And so if folks are interested, check out my website and see where I'm coming to in a city near you.
Amazing. And I'll be sure to link that too so that folks can easily find you. Yeah, of course. Oh my gosh. Amazing. So you are a busy woman.
Yeah, a little bit.
Yeah. So I guess starting at like the beginning, what do you feel like drew you like to this fight, a very big fight specifically, and specifically to like the legislation behind it?
Yeah. So I came in in the later stage of this. So I just opened my private practice 2 years ago. Before that, I'd worked in community mental health, and then I became the executive director of the Theraplay Institute. So I was running a not-for-profit for a number of years. And then 2 years ago, I was like, I'm going to start my own practice. And I had more time, quite frankly. Like I had more time in private practice than I ever did in working in community mental health or running a not-for-profit. And so the Chicago Therapist Listserv is very, very active. And so there were a couple of therapists who were consistently posting about this legislation and submitting witness slips. And I've been doing like the passive, still important. I don't want to minimize those witness slips and the importance of contacting your legislators. I was still doing that, but like in email form, like the little bits that I could at 11, 12 o'clock at night. And then there was an opportunity for a therapist roundtable, and it was on a weekend. And I wasn't able to go, but I contacted one of the organizers and was like, hey, is there any other way that I can give feedback? Because I'd like to attend, but have a conflict. And then I was connected through a series of people who were like, actually, do you want to jump on a van next week and go down to Springfield and tell your story? And I was like, I don't that day, so I suppose I could do that. I don't know what I'm doing, but like, sure.
I love that energy.
I think my husband thought I was a little bit insane that he's like, you're doing what now? But then immediately when I said it, he's like, oh yeah, of course you should go. And like the night before, I'd had like a really long day of sessions, and I was like, because we would meet at like, I think the van would leave Chicago at like 5 o'clock in the morning. We would have to meet up. It was some ungodly hour. And so like getting up at like 4:30, whatever time it was, I'd probably off and making it sound worse, but it was bad. And I was like, I'm not going to do it. I'm just not going to show. And he was like, you have to go. And I was like, no, I don't. They've got other people. I don't know. It'll be fine. And he convinced me. He's like, no, you should go. And then as soon as I came home, I was like, oh my God, it was so great.
Amazing. So that like just drew you in to like this fight.
Pretty much like I'd never lobbied before. So I worked with large lobbying group. They're throughout the United States, but the People's Lobby, we have a huge branch here in Chicago. So they're really the ones pushing this legislation, working with Representative Lindsay LaPointe was one of the first co-sponsors of the bill. And so working closely with her to get this passed, and it took a number of years to get where we ended up here today. And so I really came in the final push of the last couple of months of going to Springfield, lobbying, making phone calls, motivating more people, not just therapists, but other, you know, anyone who needs mental health services, friends, family who are located in Illinois, like contact your representatives. Here's the script. Here's what I need you to do. And so a lot of that work was done. I did kind of in the last hour once I found that I had capacity.
Amazing. Wow. So how long would you say it took from start? Yeah.
I don't actually know, and I don't want to misquote
It's
since I wasn't
okay.
there in the very beginning, but it was a couple of years from
Okay.
like the first like needs assessment of like how can we get where's really the sticking point of why it's hard to access mental health care. And so I
Mhm.
don't know who started that like kind of groundwork of like, look, our therapists aren't paid. And
Mhm.
because our therapists aren't paid much by a lot of health insurance companies, if you have in Illinois, if you have Cigna or you have United Healthcare, it's very hard to find a therapist unless you go with one of the big hospital systems who have more opportunities for revenue streams versus those in private practice. If you have one of those plans, you basically aren't getting mental health care. And so
Wow.
who figured all of this out? I have no idea because it's something that, we as therapists know every day, but not
Mhm.
something that a lay person would otherwise know. And so
Mhm.
I don't actually know who did all of that groundwork and then said, "Look, if we can pass laws to make sure therapists get paid, that's how we extend mental health care and we expand it throughout the state." So the with insurance companies now needing to pay this floor rate, I fully intend once, the hiccups and the glitches are worked out next year, fully plan on joining other panels because I'll actually
Yeah.
get paid. And
Right.
so we anticipate this will increase access to 2.5 million people in the state of Illinois.
That I just got chills. That's a crazy number.
Yeah, 2 billion.
Wow. Are you able to share what those floors would be for reimbursement?
Yeah, so it would be the rate is 100 I don't know where we came up with this number, but it's 141.7% of the Medicare reimbursement rate. And so
Okay.
that ends up being about $167 a set for a 90837.
Wow. Incredible. And like on par with
Right,
what it should be.
exactly.
Really.
Right, exactly. The other pieces that are instrumental to this legislation are that insurance companies also have to pay for those who are pre-licensed working towards clinical licensure. They have to reimburse for those services under someone who is clinically licensed. So,
Mhm.
like right now in Illinois, Blue Cross Blue Shield is the only one who will reimburse for interns. Now
Wow.
we'll be able to bill for interns work. We're able to
Amazing.
bill for people as they're working towards their 3,000 hours, provided that they're under supervision of a
Mhm.
licensed, clinically licensed mental health professional anyway. Now we can bill for those services and then allow other growing professionals to make more money as well, that we're not just having to figure out how do we pay you when we can't get paid for your services. Another piece of this is that impaneling can't take more than 60 days. So, right now, like they give you, it could be 10 days, it could be 180 days. You just sit in limbo land waiting to know if you're impaneled. And now insurance companies will have to give you an answer, yes or no, within 60 days of your application.
Wow. I have heard from, I probably should have added this. We connected through the
Yeah.
Instagram talking about these rate lowerings and like putting doctoral level with master level, like just
Yeah.
really horrible, awful things happening with
Yes.
reimbursement rates. And I had read other comments on there that people were waiting years to hear
I
back
know.
about paneling. And it's like, what do you do in this interim where you're trying to be accessible and we're trying to like provide this accessible care and we're just so I'm so happy that you guys were able to slip that part in because
Yeah.
yes, the reimbursement rates are great, but like we have to get paneled to
We have to get
utilize
paneled
them.
first. Right.
Yeah.
Exactly. The other thing that was passed by a different piece of legislation that I had no part of, this when this was passed in 2024, I believe. Someone's gonna quote me and say she's wrong. So but there's a different piece of legislation going into effect also in January 2027 that gets rid of the insurance companies can no longer require pre-authorization for outpatient mental health services.
Amazing. Do you guys feel like you run
Amazing.
into those a lot with the prior auths?
So in Illinois, the biggest employer that requires them, Chicago. So any city
Oh,
of
wow.
Chicago employee, which is a lot, you
Yeah.
have to go through jump the hoops of Telegen, if anyone is familiar with Telegen, and that is the bane of my existence. So I don't get a ton of them, but when I do, they are an enormous time suck and you're not gonna pay for any of that.
Yeah. Yeah,
And you get
or
no
you're paying
nothing.
admin to do it.
Right. Yeah, and I don't have an admin staff, so I'm just
Yeah.
doing it, which means I'm just wasting my time because
Oh
I
my
have to do
gosh.
it for my clients to get
Right.
care, but it's not like a good use of my time.
No, absolutely, and I'm sure it's, not a very easy process. I'm sure it's forward and
No.
gosh, so we have the prior auths in there. Is there any other sort of, like, caveats in this bill that therapists would be like, "Oh, this is, like, an amazing addition to add?"
No. I think that covers it. I will say that there were a
Amazing.
couple of things that there are when you say caveats, there are a few things that the legislation does not apply to, and I think it's important to
Okay.
note that because this is not
Yeah.
going to mean immediate coverage for anyone.
Mhm.
So, this does not apply to Medicare or Medicaid plans, even those that are administered by Humana, Aetna, whatever. This does not
Okay.
apply to any of the state-run programs. The other thing it unfortunately does not apply to is state employees. So, I don't remember the where that was in the battle, but that was a fight that was lost. So if you are a if you are a state of Illinois employee, the insurance plan that you have is not required to follow this. So there
So
are
interesting.
yeah, and I like I said, I don't remember the ins and outs of why that was.
Yeah.
So there are still some people who will be left out by this, and that sucks. Like there's no other
Yeah.
way to phrase that or there's no sugarcoating it. That really does suck. And it's a step forward for 2.5 million people, plus all the therapists that will be impacted by it.
Yeah, 100%. That's still a very crazy number, and it's hard that this is just based in Chicago right now. Like, do you find that this has, crossed state lines at all or is happening in other states?
So we're the fourth state to pass this legislation.
Wow.
I believe I'd have to fact check this. We were actually talking about this weekend in another therapist roundtable of which the other states. I believe Washington State has passed something similar. And somewhere on the East Coast, another state passed it. I want to say it's either Massachusetts or Vermont, somewhere in New England, another state has passed this, but and I forget what the fourth state is, but none of them have gone into effect yet. So this is legislation that has been
Mm.
passed, but if I remember right, I believe all of them are going into effect in 2027. So we have yet to see how this is rolled out and if insurance companies put any other barriers in place that we try to eliminate as part of the legislation. And I know that there's a concern about premiums going up, and that is a very real possibility. And that is obviously not the goal and not the hope
Mhm.
because insurance companies have plenty of money.
That's what I was gonna say. If that happens, like, it is not because of this bill, it is because insurance company is seeking an opportunity to raise premiums.
That's correct. And then blame it on the therapist and blame it on mental health because it's
Mhm.
an easy scapegoat. But really, it's that you just
Mhm.
don't want to hit your profit margins.
Mhm. Yeah. Do you foresee any other, like, potential, I don't even wanna say consequences, but, like, hiccups that could happen when this does get fully rolled out?
No, I think that's from other therapists I've talked to, that's the hesitation is the unknown. Like, because
Mhm.
if we could anticipate where the hiccups would be, okay, well then we could we could plan around that, right? Like we could legislate for
Mhm.
that. We could have put
Mhm.
it into the bill. And so I think it's the insurance companies come up with so many cockamamie schemes that it's like, what could they come up with? I don't know. I could never have envisioned that.
Yeah.
I'm sure any of the therapists listening to this have had some insane, crazy story with insurance. My latest battle is that so my practice is growing, and so up until now, was just billing everything under my personal individual NPI type 1. And I was like,
Mhm.
"Okay, I actually need to get a group NPI number." Went
Mhm.
on to NPI, like, did all my stuff. I was like, "Okay, now I'm gonna go through the impaneling route, switch everything over." I go to submit my roster, and they're like, "The roster, you didn't use the form," even though there's nowhere to find the correct form. They send it back and say, "Not only did you not put it on the right form, but here's where you resubmit it, but now your case is closed." So I couldn't resubmit it because they closed my case. So then I went to go into my portal account or whatever with the insurance company to say like, "Okay, I'm resubmitting this now, but because my case was closed, my portal access was like completely cleaned out." So I had to
Oh
start
my
everything
gosh.
from scratch over again, all because I didn't put the information on the correct form, that they never provided the correct form.
My gosh.
That
And
it's
if
like,
that isn't an explanation of in dealing with insurance, I don't
right?
know what is.
Right? It's like I didn't actually do anything wrong other than I didn't have the form that you didn't even tell me I needed to use. And like, so with stuff like that I'm like, what are they going to come up with that we have no way of anticipating
Mhm.
what weird stuff insurance companies may pull out for us that we're like, we just couldn't have planned for that.
Yeah, I think that's a very fair concern to have. I also relish a little bit in that you guys definitely did safeguard, like,
Yes.
as much as you could anticipate
Yes.
happening, and it's just unfortunate that it's up against this conglomerate that just pulls out a lot of wild cards, unfortunately.
Right. Right. And it
Yeah,
it is still a really big win.
it
I
is.
mean, thinking about how much more all of us will make is a great starting point, but also how many more families an individual be able to serve that I don't have to immediately turn away because I don't accept your insurance
Mhm.
because I can't afford to. Because it's funny that like I want to pay my mortgage and eat. It's not like I'm trying to.
Right.
We don't go into this profession being like, wow, therapists make a lot of money. Like, I've never met a
Never.
single therapist who comes into this profession like being like, this is where we make bank.
Yeah.
But, like, funny that I would like to be able to eat something other than ramen, no offense to Top Ramen, but it's wild. It is absolutely wild, and that so many of us are in private practice or are entrepreneurs, and so we're paying 40% in taxes on
Mhm.
top of our otherwise operating costs. I mean, our mental health model in America is really private practice or community mental health or hospital systems, like, they're it you know I'm sure you've had other episodes where, like, the systemic issues within mental health are just a bigger part of the conversation.
It is, yeah, and so many it's hard even in private practice with so many things out of our control, like, I therapists try to, like, keep their rate like, not
Right.
do rate increases every year and, like, try really
No.
hard to, like, maintain the same reasonable rate throughout the years, but then the costs go up every single year, like, I think in January, we all get the emails of, like, due to whatever fucked reason they wanna give, we're increasing,
Yeah.
your rate for your software or your rate for your QuickBooks or your rate for whatever. By the way, no new
Yep.
features, like, nothing
No. Mm-mm.
improved,
No.
just
No.
more money. So it
More
gets
money.
tight, the margins get tight.
Right. Yeah, I know we hadn't gotten Blue Cross Blue Shield hadn't raised their rate in 10 years for therapists.
My gosh.
We got a raise this year, 1 cent. That caused
No.
so many more problems for me, I can't speak for other therapists, but, like, to change all of my internal accounting things for that 1 penny. This is an insult. 10 years and I got a 1 cent increase. In no other profession can you continue to get experience, accreditations, certifications, and your wage doesn't reflect the experience and work that you put into improving your craft and becoming a better therapist, becoming a better professional, and yet the dollars and cents hurt you for becoming better at your job
It's
because the
wildly
return on investment
offensive.
isn't there. It's wildly expensive. And yet we want to be better, right? Like
Mhm.
we have to take CEs, right? Like, we have to take continuing education credits. But for many
Mhm.
people, it's not just I take a credit. I'm going to do another certificate program. I'm going to
Mhm.
do another prolonged period of study because I want to get better, because I want to help people.
Mhm.
And but where does that money come from? It's already the tight margins to be able to do my job better. And no other profession does this happen. No other
Mhm.
profession.
Mhm.
And it's
We
just
never hear about like the doctors and the surgeons struggling to pay for this like additional training that would make them, better at their job at the end of the day.
right. Yep. Or marketing executives, advertising executives, bankers, heck, even
Mhm.
mechanics. Like, you become better and specialize, like you charge a higher rate for the work you do on real building someone's engine. Like,
Mhm.
you work your way up. Chicago, I don't, depending on where folks are from, but like Chicago, we have a very big plumbers union, a very big electrical union, right? Like, you move your way up in the union, you get better benefits, you get better esteem because you're better at your craft and you make more
Mhm.
money. Not for therapists.
Not here. And this
No.
is obviously very wide amongst therapists.
Right,
Do you
right. Preaching to the choir.
Yeah, it's like but I think it also helps to just, like, feel seen because I think especially private practice, people are, like, looking at their books by themselves or, like, trying to acquire clients by themselves, and it's like, "What is wrong with me?" And it's not us, it's, like you said, this bigger systemic issue,
Yeah,
unfortunately. But do
yeah.
you feel like you had any, like, pushback or naysayers throughout this
Yes.
process?
Oh, definitely.
Interesting. What
Yeah.
were their, like, arguments against it?
It was largely the insurance lobbyists, because the insurance companies can afford expensive lobbyists, whereas, like, people's lobby is like, we're grassroots. We're people who are getting into a 15-person van and driving down there, in the middle of the night, basically.
Yeah.
And so it was a lot of lobbyists saying, well, if you do this, it's going to increase rates. And
Mm.
we're going to have to increase premiums. And people are already complaining about how much they pay in premiums. And we don't have a mental health issue here. We don't have people have access to services. So those were the common ones,
Mhm.
was the cost factor. It's like, yeah, therapists are bad people, or like they're not
Mhm.
just like that. We also had some initially the legislation HB 1085 didn't pass initially. We actually passed in veto session. It didn't pass initially because Governor Pritzker's office was indicating that he wasn't opposed to the legislation. What he was opposed to was that the way the floor number was set was tied to a federal number of the 141.7% of the Medicare premium.
Mhm.
That he's like, I don't like that at the federal level in Illinois, we have no control of what that Medicare rate, floor rate is gonna be that we base our percentage on. So it's actually they went back and I have no concept of this because I was like numbers, that's what I had. It's based on a much more complex calculation that is less tied to the Medicare number, but for simplicity's sake, it is still tied. But that was Pritzker's issue, is like, I don't want this tied to a federal number that the state of Illinois doesn't have control over.
Gotcha. I hate to say that I can understand that a
I
little
can.
bit.
Right. And so then, but
Yeah.
we knew that before it went to him and he vetoed it. So then we
Mhm.
had a chance to rework the legislation, rewrite it with a different calculation, and then push it through. And then as soon as like with knowing that like all of this was changed, then he was like, okay, when it comes to my desk, now I'll sign it if they pass it. So it was passed in the 11th hour in veto session.
Wow.
Mhm.
Scary.
Very. Yeah. So we went back down a second time in the days leading up to, like, in the midst of the 2 weeks of veto session, and it was very much like these are the certain legislators and senators that we need to find. This is the person we have to hound, wait for them outside their office, and then sprint, find them, give our very quick spiel, and then now go find the other person. And then you'd wait for like 2 hours because they're in a meeting and on some other thing, and then we gotta,
Wow.
like, track them down. So it is a lot of run, wait, and then sprint, and then wait. Yeah, a colleague of mine, another therapist who was on this journey, and she was in it longer than I was. There was one senator in particular we were trying to track down, and she saw him, like, duck out of, like, a side door of his office, basically, and so she was like, "That's him, let's go," and so we went sprinting down the hallway to get him, and he was, like, about to cut across, like, a courtyard to go to a different part of the courthouse, or of sorry, of the Capitol, I should say, and she, like, tried to jump in front of him to, like, get the door for him, like, open it, and he, like, didn't really see her coming, and she almost, like, smacked both he and I in the face with this glass door, and fortunately, he was so chill about it, he just started laughing and was like, "Well, hello," and she's like, "I was trying to make an impression." He's like, "Well, you did, ladies. You made an impression. I suppose you wanna talk to me, huh?" We were like, "Yes, we do." He's like, "Walk and talk with me," and so, like, we were, like, hobbling along the side, like, he's walking straight, and both of us are, like, flanked on either side, like, sideways walking, like, quickly giving our spiel of why we need him to sign on to this, and
My God.
he's like, "Yeah, I'm happy to sign on to that." And we're like, "Can we take a picture with you?" And he's like, "I would love to take a picture with you." And so, like, all 3 of us are just, like, big, cheesy, laughing grins because we almost smacked him in the face with the glass door on the way to talk to him.
I respect that hustle so much. Like, you guys were
I know.
really
Yeah,
wow,
we were gonna make sure
insane.
he heard us and saw us.
Yeah, and that he did.
He did. Yeah, I sent him a thank you card, like, handwritten thank you card after that, was like, "I was the girl with the girl who almost hit you in the face with the glass door. Glad you're okay. Also, thank you very much for agreeing to this legislation. Thank you very much for saying yes."
Oh my gosh, I can't even imagine the amount of conversations you must have had with people like that over all this time.
Yeah, and it was a lot of I mean, our vanity, practicing your elevator speed as quick as possible. What is the shtick, the, like, personal story? Why does it affect you? Why, as a human, are you in front of this person who has the ability to bring this law to life or to veto it? And so
Mhm,
sometimes you've got 30 seconds, sometimes you might get a couple of minutes, but either way, and how can you inspire someone to care?
mhm.
And what is the quick story? Because people don't want facts and figures. That's not what has an impact. It's the personal stories that do.
Mhm. Yeah, yeah. And I think it's also I'm, like, backtracking a little bit here, but it just came across my mind that the naysayers to this have never said that therapists aren't producing change in the clients that they see, and therapists aren't, like, these
No.
highly specialized, like, that was never on the table, which I am honestly, like, very happy about,
Yeah.
and because, I think it's so easy to say, like, well, X amount of people are in therapy. People can pull stats from anywhere about anything,
Right.
right? And
Right.
gear them in their favor. And so I think it just is so powerful to know that the work that therapists are doing and the quality of care they're providing and the outcomes from therapy are not the reasons. It all
No.
comes down to the
Money.
insurance companies want to make more money and want to
Yeah.
spend less.
Correct. Yeah. That was those were the primary barriers. Was not we're not doing good work. It's not that therapists aren't valued, but it's thank you for your work. Thank you for your contribution, which is great, but that doesn't pay the bills.
It does not keep the lights on.
Doesn't. Mm-mm. No, it sure doesn't. So, no, that wasn't the resistance. That wasn't the resistance
My
at all. And I think the other thing that I don't know that a lot of people were willing that people didn't say, but I think was in it didn't hit until I was really pushing my friends and family is the apathy. Like, because it affects you don't like therapists should make more. Okay, fine. Like, that doesn't affect me. It was when we were able to say, like, but you don't understand, I can't take insurance. I can't my practice, I only take Blue Cross Blue Shield PPO because I cannot afford to take any other insurance, which means
Mhm,
anyone else who has that insurance, Aetna, Humana, Cigna, they can't come to me unless they have the financial means to pay out of pocket for me, which just makes services inaccessible. And so when you can put it in those terms, when I can say, "I haven't gotten a raise in 10 years," and when I do, it's a cent, it's a
mhm,
1 penny raise in 10 years. Would you
mhm.
stay in a job where you don't make money you don't get a raise in 10 years, would you stay?
Mhm.
When you personalize it. But up until then, I think some of the and I think this is the case for a lot of legislation, not unique to us, is like, it doesn't affect me. Why do I care?
Mhm.
But it does
Mhm.
affect you. It affects someone you know who is struggling with depression or postpartum anxiety or is going through a divorce or, we all survived COVID by the skin of our teeth
Mhm.
and no one's doing well after COVID. And guess what? You've probably got a little bit of anxiety. Wouldn't it be nice if there was someone that your insurance paid for to help you so life could be a little easier?
Mhm.
And so it really isn't. This was a way, the whole motivation behind this was to increase access to mental health services. And a
Mhm.
route to do that was to pay therapists.
Mhm.
Yeah. Yeah. And I think that also therapists can get painted as like caring about the accessibility. Like, we're okay with charging our rates and we're okay with being private pay. And it's like, well, actually, I would love to take insurance. It would actually
Right,
be so much easier on the
right.
marketing front, on
Yes.
sustaining clients, on
Yeah,
being able to do long term care with them because it's affordable and it's
right,
not, we are not their financial barrier. Like, I don't want to be someone's financial barrier, but I also want to be providing them the quality care that they need. So it does put us in a really hard
absolutely.
position. And to hear people say, like, well, therapists, charge X amount so they don't care about accessibility to care. It's like, well, you guys are boots on the ground trying to make care accessible. Like, of course we care about
Right,
accessibility.
right, right. Yeah.
Yeah.
And
Yeah.
until the day comes, which it won't, where we have universal, then all of this becomes a moot point, but we are not parts of Western Europe.
We are far, far away.
Far, far, far away from that. Yeah. So what can we do with the systems we do have in place to increase accessibility for those that we see? And this is a big step in the right direction. And I understand that there are, speaking with a lot of therapists who are like, I'm not going to join onto other insurance companies because at first, until I see how difficult insurance makes
Mhm.
this for me. What, like we talked about already, what other barriers? So I know some therapists are understandably hesitant of like, oh, it's too good to be true. I'll believe it when I
Mhm.
see it.
Mhm.
And that's real. I mean, that's
Mhm.
real. It's a lot of administrative work to become impaneled. But hopefully this streamlines it. That is part of the legislation, is to make it a little bit easier and faster.
Yeah. Is there anything you'd recommend to Chicago based therapist, like as we near closer to January?
Yeah, so the People's Lobby still has a mental health task force where we are continuing to talk about this and working through what other barriers exist in our field. What other problems are there in the mental health world? And so we actually had a therapist roundtable this past Saturday talking about like, okay, let's dream big. We don't have to talk about how we get there, but what other problems exist for us as therapists. And as a lobbying group, what can we do to make things better? And it
Mhm.
starts with those conversations. That's where HB 1085 started, was in listening sessions with therapists of what needs to change. And so for those who are unsure about this, you can always find what's going on with the mental health task force through People's Lobby website. The Chicago Therapist listserv is rather large and active as well, that there's usually posts on there coming up about the work that we're doing, and it's free. You don't have to pay anything to participate in this. You don't have to be consistent. If you're like, you know what, I've got capacity this week but I don't next month, that's fine.
Mhm.
But there are places for, whether it's submitting witness slips, whether it's just come and give your opinion, but there's always snacks. Therapists love free snacks.
We do.
We do. So we're easily swayed by a bag of popcorn. So that would be my recommendation, is like, that's kind of the ground point. And that if things don't go well, then we will be going back to the legislators that helped us pass this, going back to Representative Lindsay Lapointe, her team, to say, let's do something. What we thought we passed
Mhm.
is working. And so we got to go back to the drawing board on. And that's
Mhm.
what, our legislators are here for, is to work for us. And so
Mhm.
we found a good one. We found a good one who's definitely an advocate.
I love that. I love that. Do you think that that same advice applies like across state lines if people are looking to like bring this to their states or wondering like what they can do in other states?
Yeah, I think is finding a representative or senator who is willing to take this on, who is willing to be the sponsor or co-sponsors, who have the constituency, who has voted for them and who they're listening to, and having a group. This is not something that a single therapist could have done. This was because
Mhm.
we had the full support and weight of the People's Lobby really pushing this, that they had the ability to organize and the communication strategies and the people working on their team to say, this is where we need to go. These are the days we need to be somewhere. These are the specific legislators that we're speaking to. These are the ones we have to target. These are the ones who are on the fence. So having a lobbying group who understands how to lobby, because most therapists don't know how to lobby. I sure as heck had no idea what I was doing. I just ran where someone told me to run, just
Mhm.
not Glassdoor. And so I think that's another for people who are in other states considering this is there a group, whether it's grassroots, whether it's an existing lobbying group, is it through your local NASW or MBCC chapter that you can
Mhm.
work with? Because most NASW does have a large lobbying arm as well. And so is that in your specific state the one that becomes the organizing force? So I think those would probably be my two big pieces of advice is find which senator or legislator is going to be your sponsor and really get invested in this and
Mhm.
who's your group, because this is not something that a solo person can do. And one of the women who was really behind this and was really a force in all of this, she at one point was talking with her and was like, "Man, I feel like I came in on the 11th hour and I feel bad that I wasn't there these last couple of years in
Oh.
the get-go." And her point was, "You know what, though? It's a relay. Sometimes some of the people who were here in the beginning got tired, burnt out, their lives shifted, and they weren't able to be here until the end. And someone had to carry it's a relay, and someone had to carry the baton over the finish line. And so you were part of the final leg of the relay. And I just feel really honored and humbled to have been part of the relay at all. But it does mean that I don't have as much of the initial history because I wasn't there in the first couple of legs.
But how true of a statement that, like, because these things are so long and just so time intensive and effort intensive, and it's hard for one person or one single group to ever sustain that. So, like, I think the relay is a perfect reframe of like, you can come in at any point of this and still provide like the really high value and still be part of like the winning team at the end of all of this.
Yes, definitely. Definitely.
Yeah.
Yeah, and it felt really good to be there at the final press conference of like, "We did this. We did this."
That is so cool. You are so unbelievably impressive. Oh my gosh.
Well, thank
So
you. That's so
amazing.
sweet.
Yes. Is there anything else that you would want to add or to share with anybody listening?
I if there's anyone who, like, wants who gave you the starting script of what we did here in Illinois, because I am not that primary person, as I've said. I am happy to put you in touch with the people who, like, did that initial groundwork. If you're like, "I need to bring this to my state, but I don't know where to start," I'm happy to put you in touch with the people in Illinois who were there at the start, who can say, like, "We can't do it for you in your state, but take this as, like, a starting point." I'm more than happy to put you in touch with those people. So contact me for that, and happy to talk about, like, as the boots on the ground, what we were doing between the running and the activism behind the scenes, because there's a lot to it, and there's a lot of people who are involved in this. And so I'm
Mm.
just very honored to be able to speak about it with you here today. And thank
Yeah.
you for all that you do, Alicia, with this podcast and Instagram, that it helps therapists to be seen, because it can be really lonely sometimes and really demoralizing, when we're helping people who are really struggling, and that we have our own struggles, but we they're in a different place, right? And
Mhm.
so the fact that you created this space for therapists is really meaningful. Thank you for all that you do.
Thank you so much. I appreciate that. I love doing it. I'm like so happy to be doing this work. I feel so lucky to be here. Yeah.
Yeah.
Well, like I
Ditto.
said, we will in the show notes. So you can get in touch with Mandy, ask her questions, check out her website, her consulting, all of the things that she is doing. There are a lot of them. So we'll make sure all of those are linked. And Mandy, thank you so much for joining
Thank
us.
you. Really appreciate being here. Thank you for taking the time with me today.
Yes, of course. All right, everybody, we'll see you next week.